I chose an article named Bad Medicine, the harm that comes from racism. This article talks about the racial discrimination that occurs in the healthcare system. More specifically, they talk about the African American population and how that population tends to receive lower quality care for diseases like cancer, HIV, prenatal, and preventive care compared to non Hispanic whites. A part of these terrible outcomes stem from racial discrimination, but also the deep mistrust the African American community has with healthcare. From 1932 to 1972, the Public Health Service tracked about 600 low income African Americans in Tuskegee, Alaska, and about 400 of them had syphilis. The stated purpose of like this whole test was to better understand the natural course of the disease. What really happened was that the Public Health Service allowed thousands or hundreds of African American men with syphilis to go untreated so that they could study the effect of the disease. This the study was called the Tuskegee studies, and this has lasting implications on African Americans' perception of medicine. This article also talks about how African American patients tend to have better health outcomes with doctors slash physicians who identify as African American as well. This article expands on this, illustrating that racially matched pairs of patients and doctors achieve better communication. This line was kind of my aha moment because I know for my family, they prefer Filipino nurses or Filipino healthcare workers to be in their team just because they most of the time they know the language and they trust them because they share the same racial and ethnic identity. So as a nurse, I can kind of be that Filipino nurse for someone else's family who identifies as Filipino.